Join the legacy of health restoration, May 11th through 13th in Green Bay, Wisconsin. A lineup of dynamic speakers will share tested and proven strategies for clinical results and sustained practice growth. This isn't your average seminar. We have hands-on activities for content retention and connection. Who can attend our event? Chiropractic students, coaching program and non-Wellness Way practitioners, students and graduates of the Wellness Way Academy, and Wellness Way doctors, staff, and spouses. Join us in Green Bay for this immersive training event designed to build your confidence in applying chiropractic philosophy coupled with comprehensive resources for strategic growth. BJ Palmer started the movement. Dr. Patrick Flynn forged forward. And now the Wellness Way is paving the path for future practitioners to run on. Prepared to join the legacy of great health revolutionaries ready to face the health challenges others can't.
Hello everybody and welcome to A Different Perspective. My name is Dr. Jason Nobles and today we are starting our month of mental health support. So one thing on the video you just saw regarding the seminar coming to Green Bay. This is the first time we've had this really big seminar in Green Bay, so I'm super excited. Hopefully we have a lot of new faces there to see, so come out and enjoy. Hope to see you there. Also, one announcement regarding the Different Perspective will not be happening next weekend because of said seminar. So we will all be at the seminar, being busy, working, just learning a ton of new stuff to bring to you, and we will not have an ADP. So don't tune in next weekend. But today, what we want to do is start our conversation regarding mood disorders, right? Our introduction into mental health. So as we go into mental health, what we want to do is discuss a different perspective because it's very difficult to kind of bridge this topic up, to open up the conversation without people thinking you're nuts. So most of the time, there's a stigma around it. People think it's all in your head. Get over it. It's basic, it's simple, just deal with it, right? Get over it. But what we want to do is talk about things that can actually cause these issues and where do they come from and why. Because if we can understand that, then we work backwards and understand why people have these issues and what we can do about them, because they are very extremely real issues. Okay, so we don't want to look at them and treat them like they are physical ailments, right? So if we treated these like physical ailments, right? So love this picture. I get that you have food poisoning, but you just have to at least make an effort, right? The guy's missing an entire hand. Just change your state of mind. You'll feel better about it. Or you look tired, having the flu, have you tried that? Get over it, buddy. So because it's so misunderstood, people often don't want to talk about it because this is how a lot of times it's just approached. I had a patient one time, a young lady, who was going through a lot of mental stress. She had a lot of turmoil. She had a lot of depression. And she was literally asked by a mental health professional if she was really depressed or if she was just feeling kind of weepy, like she wanted to curl up on her mom's lap and just have a good cry. That's kind of like rub some dirt on it and get back in there, is it not? So we want to approach these things from a Wellness Way perspective and give people a different approach to help figure out why these things are going on. So with mental health, the fact of the matter is that it is a real problem that millions and millions of people deal with on a daily basis. Actually, when we look at the numbers, just in the US, 46.4% of adults in the US will experience mental illness in their lifetime. So let's stop pretending this isn't real. In fact, if 46.4% experience it, that's basically almost 1 in 2 people, half, right? 5% of adults in the United States experience mental illness each year, which adds up to 43.8 million people per year. That's a big number. So let's get into it. First things first, I love history. Dr. Patrick loves history, so we always like start with a little bit of history. So when do these mental health issues start getting diagnosed? Well, the earliest known cases go back to as long as recorded history, right? So first things first, what we found were people started finding skulls with holes in their head, okay? This is a process called trephination. So trephined skulls have been discovered in widespread locations in every part of the world going back to late Paleolithic all the way to this century. So the belief was that demons or spirits were trapped in these people's heads, so they would cut the hole to release the spirits. Okay? Now, unfortunately, sadly, care really hasn't gotten that much better. It hasn't really improved since those days. So we look, what about bloodletting? Okay, here's the theory behind bloodletting. A form of sedation to release negative energy from the body. It was thought that if bad blood was released from the body, it could help an individual regain their sanity. So this started back in ancient Greece because they believed there was a problem of imbalance of humors in the body, right? So they believed there were 4, blood, phlegm, yellow bile, black bile. Those are the 4 humors. And if you had balance in those, because they represented air, water, earth, and fire in the human body, they tried to balance these things. They balanced them with a combination of either hot or cold, wet or dry food. And you can actually go online and look, because there's a nice little pyramid that if you're having problems with your phlegm, you want to eat cold, wet, or hot, dry, whatever it is, to help balance out the humors. So blood being one of those, if you release the blood, then you can bring more balance into the body. Okay. Now, as we go, about the time of the Renaissance, they started looking at the body a little bit differently. So there was this underlying belief that wombs made women irrational, right? So for the Hippocratics, the womb caused physical symptoms, and later doctors believed it to cause psychological dysfunctions. So this is what they called the wandering uterus. So it's, like I said, about the time of the Renaissance, and it would cause women to become hysterical or experience hysteria, right? Have you heard of a hysterectomy? So it was meant to get rid of the uterus causing the hysteria. So mental health had to do with the wandering uterus, and they believed that the uterus was a separate creature from the female, and that it wandered around inside the body. So then what they do was when women were sexually stimulated, it would migrate to its normal position where it could collect sperm and create a baby. That was the belief. I'm not making this up. So, of course, there was a treatment. Medical pelvic massage. And this was a very real thing where a man would manually stimulate a woman to bring her uterus back down to where it should be to help with her hysteria. Yeah, you know a man came up with that one, right? So, yeah, and that's where, like I said, that's where the term hysterectomy, because women's hysteria comes from their uterus, apparently, okay? But things got worse, right? So you have isolation and asylums. Now, 1850s and 1980s, there was overcrowding, poor conditions, poor care, and they started to close the asylums. Now, luckily, they have been disbanded, but in the 50s, the purpose of really using those psychiatric drugs, they were pushed as a way to get the individual institutionalized patients back out into the community, right? Because they were put in there because they had become burdens to society, and they were taken away so that they would no longer be a problem for their loved ones. And then there was just no care for those people whatsoever. So the purpose of the drugs came around to get those people back out. I don't know if the thought was they could be burdens again. I don't know how they looked at it. But like I said, thankfully the asylums and everything have been disbanded. They're no longer around. And just isolating people with mental health issues, if you suffer from anxiety, if you suffer from depression or any other mood disorder, do you really think isolation is going to help you in any way, shape, or form. Okay? Because many of us actually do it to ourselves. We just get away from people, and we always inevitably are going to start feeling worse and worse and worse. Now, here's a great list. So reasons for admission to asylums dating back 1864 to 1889. Now this is quite the amazing list. I'd do a screenshot of this if I was at home. But when you look at some of these, hysteria is right up there. Right above hysteria is imaginary female trouble, jealousy, laziness, my son got married, reading novels, right? Asthma, bad whiskey. Some of these are just fantastic. Hard study, grief, the war, vicious vices, right? Whatever that means. Time of life, egotism. All these different things were cited as reason. Gunshot wound. People were put into isolation and asylums. I mean, you could just go through that list and study it, and you just kind of laugh at so many of those different things. But whenever anybody had a problem with somebody and they didn't want them to be a burden to them anymore, check that box, give that reason, and then they're off. So what is mental illness? If there's anything we love around here, it is definition. So mental illness, this is from WebMD. Causes of mental illness, although the exact cause of most mental illnesses is not known, it is becoming clear through research that many conditions are caused by a combination of biological, psychological, and environmental factors. It kind of sounds like they just said traumas, toxins, and thoughts. So it's caused by something, okay? So what biological factors are actually involved in mental illness? So some have been linked to abnormal functioning of nerve cell circuits or pathways that connect particular brain regions, nerve cells within the brain circuits, communicating through chemicals called neurotransmitters. Now neurotransmitters, just breaking those down, are brain hormones, right? Hormones in the body are messengers. So neurotransmitters are messengers between nerves. Tweaking these chemicals through medicines, psychotherapy, or medical procedures can help brain circuits run more efficiently. In addition, defects in or injury to certain areas of the brain have been linked to some mental conditions. There you go, okay? So now let's catch up with modern times. So let's say somebody has some of these conditions. How are we going to treat them? Okay, because that's always the goal. You have a problem, you have a diagnosis, let's get it treated. So when you look, nearly 300 mental health disorders are listed in the DSM-5. DSM-5 stands for the Diagnostic and Statistical Manual of Mental Disorders. So what they want to do is they want to categorize things so they can give a proper diagnosis and classify your disease. Okay, so 7 main groups, right? You have mood disorders, anxiety, personality, psychotic, eating disorders, trauma-related, and substance abuse, right? So also in here, under mood disorder, PMS. PMS is listed as a psychiatric disease. Premenstrual syndrome. Having hormones out of balance and becoming moody is listed as a psychiatric disease. This is the standard, okay? So diagnosis, how do we got to get that diagnosis? So when you go through with Mayo Clinic, you can get a physical exam, they can do some lab tests, psychiatric evaluation, they can classify you then through the DSM-5. So once you're diagnosed with a disorder, now we can medicate, right, based on that. So when you look, what's the reality? There is a questionnaire. So this is probably the most common, the Patient Health Questionnaire. That's what PHQ stands for. So most often, people come in, they'll say, I'm feeling awful, I'm depressed, please help me. Well, okay, your labs look fine and you're fine. Okay, patient tells the doctor they're depressed. So they go back to doc asking for help, but the labs look good. Nope, you're fine. Doc, I feel horrible. Well, now you're just looking for drugs. Or it's all in your head, see a psychiatrist. Or you're depressed, here's your antidepressants. So you can't treat legally without a diagnosis. And sometimes people are labeled with fibromyalgia, generic and broad, which just means muscle fiber pain. But then you have a diagnosis and you can treat. Okay, so if there's nothing wrong on the labs, but you have all these different complaints, you can't do anything, you can't be medicated until you have a specific diagnosis, right? Otherwise, that's malpractice. You cannot prescribe anything without a diagnosis, okay? So let's talk about depression. So with depression, there are different approaches, right? There is the medical approach, which we call the fireman, right? So if you recall quickly, just going back to the fireman carpenter approach, which we call the wellness way approach. So the fireman, if your house is on fire, you're not going to call a dentist, you're not going to call a contractor to put out a fire with hammer and nails, or a dentist with a toothpick, right? You are going to call the fire department, and they are going to show up. They are going to use their axes and their hoses, and they're going to chop down doors and windows. They are going to spray everything down in your house in order to save your house. God willing, they get there on time, they use their tools, they use their training, they save your house, they save your life, okay? But once you're in that state of the fire's out, doesn't mean all of a sudden you're healthy again. So you can't live like that for very long. First off, you can't just move into that house. You have to clean it all out. You got to figure out why it got started in the first place with the fire. You have to get all the new blueprints. You got to get all the new lumber, all the new wiring and everything else, and get it rebuilt before it's safe to live in, okay? Because there is a long period of time that you cannot live in that house. But you also don't walk out to the firemen out sitting in your yard while they're putting away their stuff and ask them to rebuild your house, because you can't rebuild a house with an axe and a hose. You cannot rebuild a person with drugs or surgery, right? So you go to the carpenter, because the carpenter also can't put out a fire with hammer and nails. So you ask the carpenter, now we need to rebuild the house. So my question is always the same. What takes longer, putting out a fire or rebuilding a house? So the fire doesn't happen to a healthy house. Something has to act on it from the outside. Whether it's a quick, acute lightning strike, crazy, mother act of nature, or if it's chronic wear and tear, like the mice in the walls keep chewing on the cords, or if there's termites, or if there's water damage, or whatever happens. Okay, so now when it comes to the rebuilding process, you may deal with a fire in like an hour, and you may take 6-7 months to rebuild a house. Same thing works with the human body. So when we go back to the medical approach, typically you got an axe or a hose. You're going to do surgery, right? Or you're going to give medication. So from a medication standpoint, you're not going to do a surgery first, unless there's open wounds, right? So you got to treat the symptoms using drug therapy, whether it's antidepressants, whether it's psychotherapy, hospitalization, more drugs, whatever that is. Now, what we call the alternative approach is basically the natural approach, right? We have a picture of Dr. Oz on there because there used to be this thing called the Dr. Oz effect when he had his TV show. And that was simply that somebody would come on the show, they would talk about how their arm fell off, and they rubbed some turmeric on it, something natural, and their arm grew back. The next day on Amazon, $3 million in sales of that product. So that's the Dr. Oz effect. So really the difference is, instead of taking the medication, you want to take something natural. So you get some fish oils, you get some St. John's wort, right? You do some exercise. Exercise has been studied. It's at least 1.5 times more effective for mental health than any medication out there. You get your B vitamins, you get your magnesium, you get your acupuncture, different things to do to make you feel better because they're natural. So the question I always ask is real simple. Which one of these approaches, the medical or the alternative medicine, the natural approach, quits working first? And the answer invariably I get, because people think I'm trying to trick them, is the medical approach. Well, no, the medical approach, remember, medicines always work. They are designed to create a functional change in the body so that you can alter something. If you have these fish oils, St. John's, and all this other stuff, and you say, I don't know, have cardiovascular inflammation, you're going to burn through that fish oil a lot faster. Or if you need to feed your brain. Or B vitamins, magnesium. Okay, magnesium, you get a muscle cramp. You're going to use that magnesium somewhere else in the body, right? St. John's can be great, but where does it really work? It works in the liver. So if there is something structural or functional going on with the brain, these things aren't actually going to work all that well. Then we get to the wellness way approach. So our goal isn't to test for fires. It's to figure out why the body is going through this. Why is this person experiencing these things and not having a normal functional life like they should. Okay? Because if we can understand from a physiological aspect of this is what the body's doing and this is what the patient is experiencing, if we help the body start to function more normally by removing the stressors, giving it some nutrients so it can actually open up those pathways, whatever it needs, then teaching the people how to work from a traumas, toxins, thoughts aspect to remove the trauma and postural changes and things to the spine, right? Avoid toxins as much as possible, whether it's in the house, whether it's in the environment, whether it's in the food. And then thoughts is the toughest. Thoughts is where we are right now with the mental stress. So mental stress, the only way we really avoid it is to die. And that's not what we're after, right? Because we want to rebuild the house, and you can't rebuild a house if there is no house. So when we talk about getting into definitions of depressants and antidepressants and what they actually do, the whole theory is kind of misbased, okay? So when we look at the WebMD definition of understanding antidepressants, so it says right here, if you've read up on antidepressants in newspapers, magazines, or on the web, you might see depression explained as a chemical imbalance or a serotonin deficiency. Unfortunately, it's not that simple. We really don't know what causes depression or how it affects the brain. Okay, good. I love that they said that because it's an honest response, right? We really don't know. Perfect. We don't exactly know how antidepressants improve the system. Okay, that's something pretty big there. They don't really know how it works. That's not, we didn't publish it, that's from WebMD, right? So let's talk about one of the main hormones, neurotransmitters, that is often tried to be manipulated, which is serotonin. Serotonin is a chemical that helps stimulate mood. So you get the levels high and you'll be in a good mood is the theory. So serotonin, or 5-hydroxytryptamine, 5-HT, is a monoamine neurotransmitter. Mono one, okay? Single amine. So from this monoamine, there became the monoamine theory, which we'll get into a little bit. But the monoamine theory is based on one thing causing one disease, okay? So that one thing, it's only been ever studied to find that there's only one time, one disease, Parkinson's disease. Parkinson's is caused by a lack of dopamine, right? It's a monoamine, dopamine. Low dopamine is the only thing that will lead to Parkinson's. So around the time when they're discovering this, if they increase dopamine, that the symptoms from Parkinson's can start to lessen and lessen and lessen, that, well, maybe if serotonin elevates mood, then a lack of serotonin causes depression. Okay, and that's where this whole monoamine theory for depression came along. So let's go back into serotonin. Its biological function is complex, multifaceted. It modulates mood, cognition, reward, learning, memory, and numerous physiological processes such as vomiting and vasoconstriction. Okay. Biochemically, the indoleamine molecule derives from tryptophan and via rate-limiting hydroxylation, blah, blah, blah. Position of the 5 position of the ring. Okay, lots of science. Let's move on. So, forming the intermediate 5-hydroxytryptophan, also known as 5-HTP. You'll hear a lot about this when it comes to mood. And then decarboxylation to produce serotonin. And then further down the road, serotonin will actually convert into melatonin, which is why when you eat lots of tryptophan at Thanksgiving, the tryptophan doesn't directly cause you to want to go to sleep. It's the tryptophan converting downstream into that melatonin will actually help shut you down. Serotonin is primarily found in the enteric nervous system, located in the GI tract. Catch that? GI tract. 90% of serotonin is produced in the gut. However, it's also produced in the central nervous system, about 10%, right? So, Merkel cells located in the skin, taste receptors in the tongue. Additionally, serotonin is stored in the platelets and is released during agitation or vasoconstriction, where it acts as an agonist to other platelets. Okay, that was a lot. So, basically, serotonin helps elevate mood. Let's go back to that, okay? Now, so they developed these drugs that are called a classification of SSRI, or selective serotonin reuptake inhibitors, okay? Here's a list. There's a bunch of different ones, right? Prozac, Zoloft, Surzone, Paxil, Luvox, Cymbalta, Lexapro, Effexor. All of these are classified as SSRIs, selective serotonin reuptake inhibitors. So how do they work? So it is thought, these drugs are thought to have a good influence on mood, emotion, and sleep. Okay? Thought. So remember, every drug is either one or the other. It's either stimulatory or it's inhibitory. So after carrying a message, serotonin usually reabsorbed by the nerve cells, known as reuptake. So serotonin does its job, delivers its message, and then it's brought back in. Okay, so levels go up and then they come back down. The SSRIs block the reuptake, so they inhibit. So they keep serotonin increased circulating around. That meaning is more is available to pass further messages between nearby nerve cells. So the theory is, if we block the reuptake of serotonin, there's more available serotonin. Serotonin elevates mood. Serotonin, therefore, by taking these medications, will increase your mood and make you happy. That's it. That's how they're supposed to work. That's how they're designed to work. Do they do that? Yep. Yes, they do. That's exactly what they do. What does every drug have? And I know you're thinking I'm going to say side effects, but I'm not going to say that. They have unintended effects because the goal of these SSRIs is to increase serotonin by blocking its uptake. What else do they do? They all have other effects that they don't want to intend to, but they do the one thing they're trying to do and all this other stuff over here. So what are some basic side effects of SSRIs? Insomnia, headaches, rash, blurred vision, drowsiness, dry mouth, agitation, nervousness, feeling dizzy, pain, upset stomach, nausea, diarrhea, reduced sexual desire, problems with erection or ejaculation. See, the problem is they can't localize any reaction by giving a medication. They can't target one thing and only cause one thing. Because of the body, how the body works, like the Swiss watch, converts all these different systems working together, and you can't affect one and not affect all the others, right? So what other side effects? With some people, especially children, young adults, they may be more likely to have suicidal thoughts when they take SSRIs. Studies show that when compared to results from taking a placebo, chances of suicidal thoughts doubled when taking any kind of antidepressant, including an SSRI. So if you have thoughts of hurting yourself while taking an SSRI, definitely call 911 as fast as possible. Okay, because by that time, with the chemical imbalances and all that stuff kind of being increased and making it worse, a lot of times you get to the point where you're not in control. So some of the main studies that are actually kind of coming around as one of the side effects, is that you will develop new or worsening depression. So when you take these, you will have depression, and then you'll also have more depression, and it'll get worse. Okay, so what's the problem with that? Well, you can go online. This list, I printed off. I want to make sure you can see all this. See how little that print is? This is just from 1988 to 2011, 12 years ago. These are something that happened. I'll list suicide. They'll list the drug, Effexor. 11/11/21, England, lawyer impulsively jumps in front of a train. Effexor, like all ADs, can cause impulsiveness. This is a list of all these major, even mass murders and things like that, even the school shootings, and what specific SSRI that the person was on. That's a lot. And it's not stopping, it's getting worse. So, moving on. SSRIs are not addictive. So, if you want to get off them, it's not easy. Stopping antidepressant treatment abruptly or missing several doses can cause withdrawal-like symptoms. You can't just stop. So you can get actually bad rebound effects. So this is sometimes called discontinuation syndrome. So you can be very rough and cause more symptoms. So you have to taper down when going off these under the guidance of a medical practitioner who prescribed them in the first place. So work with your doctor to gradually and safely come off these when it's time. So this is my opinion, okay? Just my opinion. So this Giving these out like candy to these people does not help. It's a massive, massive, massive disservice to these people. And then a lot of them end up with treatment-resistant depression, which means that no matter what treatment you try with these people, nothing helps. So no matter how much you try, no matter what medication, just doesn't work, okay? All right, so let's talk about a new paradigm, because when it comes right down to it, if I put this picture up, all of you are thinking roughly the same thing, but what does this plant need? Okay, so a lot of people are looking at it thinking, oh, this plant needs water, oh, it needs fertilizer, it needs some sunlight, you just need to move it. Nobody's out there thinking that this plant needs drugs or surgery to get better, right? So how many more leaves does this plant need to be removed to be healthy? Whereas how many body parts do we need to remove to be healthy? How many drugs were we born lacking? None, right? So we see people walking into the office every day looking like this plant. But when the picture came up, you're like, oh, it needs sunlight, it needs good food, it needs good water. We can take better care of plants than we can people. So you give it water, it doesn't change, okay? It must have been good with water. You give it food, doesn't change. You move it into the sun, doesn't change. So you're doing all the right things, but still not getting the results. Sound familiar? Right? But what we don't see is that, every night the cat walks by, pees in your plant, and then walks on off. So there's this unknown other toxin getting in there that's causing damage, right? Traumas, toxins, thoughts. What is it? Is it a mental thought? Is it environmental? Is it pesticides or chemicals or mold or viruses, whatever's in the body, driving the system nuts? So that's what our goal is, to always find the why. Find that cat peeing in your plant so that we can help your body get back on track, onto a healing phase, so that your body can start to rebuild. And our goal, our job is just really simple. Guide you on that path. That's it, okay? We use the Swiss watch principle to those ends. So this is how the body works. When we're talking about mood disorders, we're talking about the brain, right? So the nervous system. Does your brain operate independently in and of itself? And I think we all know the answer to that is really no. We have all these other systems, right? You have your immune system, your digestive, your cardiovascular, your hormones. All these systems work together. And if there's an effect on one, let's say you stub your toe. If you just stub your toe, does just your muscles hurt? No. Does your blood pressure change? Yep. You swear, do you get stressed out? Yeah, it hurts, right? Blood pressure goes up, you start sweating. All these different systems work together. Like if you go back to the picture, if you look at the nervous system, if you're massively stressed, can you get sick more often? Uh-huh. Can your hormones make your brain go crazy? Of course they can. So if you just try to affect one of these, this is where those unintended effects come in, and you try to medicate one thing and get all these other unintended effects. Let's stop calling them side effects. They're just effects that happen because you're taking that medication. There's just not the goal of the medication to create that change. That's what it is. Serotonin. So when we get into the literature, a little bit about serotonin. Remember, these things are thrown off by something. Big picture here. Approximately 90% of the human body's total serotonin is located in the endochromaffin cells in the GI tract, where it regulates intestinal movements. So if you have, let's say you have bloating, let's say you have IBS, let's say you have gas, let's say you have all these other food allergies, let's say you have yeast overgrowth somewhere in the body. If that is in here, you have disruption. Do you think that your body can make the amount of serotonin it needs to make if we are toxic in those things? Or let's say we are deficient in the precursors and the components we need to make serotonin, like vitamin D. Can we make the proper amount of serotonin? No. So either we're toxic in something, or we're deficient in something, or both, and we need to figure out how to bring balance into the body so that it can make those things properly. Simplest way to do is just take a picture of the gut, and you can see how much gas and swelling and bloating and all this other stuff is going on in there that will cause disruptions in the factory, so to speak, that makes the hormones. Okay? So you have this gut-brain connection. So many of you have heard of this before. So if we have healthy gut function, then we can get normal behavior, cognition, emotion, healthy levels of inflammatory cells, normal gut bacteria, and then we can have healthy nervous system. Simple, right? But if we have abnormal gut function based on those things, we can see changes in behavior. We can see changes in thought processes, cognition, emotion. We're more susceptible to inflammation. We have a less beneficial gut bacteria, which affects the immune system in the gut. And because of that, we are going to get abnormal nervous system function. So we have, for every one nerve that goes down from the brain to the gut, 10,000 plus come back. So if the signals aren't appropriate, I'll say, if the signals get dysfunction, if there's something affecting those, whether it's even posture from the brain going to the body, or if it's inorganic foods that have a lot of pesticides and chemicals and you're killing the probiotics and everything in the gut, you are messing with that factory, and then you're going to have the stress factor, you're going to have the disease factor start to happen, causing gradual decay of that central nervous system function. Okay, so now when we get into more literature, this is the cool stuff. They do what's called systemic reviews, because remember, with the monoamine theory, what they tried to do was prove that serotonin deficiency causes depression. What the systemic review found, that all the research that showed depression was from a lack of serotonin, did not exist. It didn't exist. So the first medications actually that were used for depression were called tricyclics, right? They were very toxic, highly addictive, and it turns out they didn't want people taking them. So then the major medical discovery happened when a deficiency in dopamine was found to cause directly Parkinson's. And that's where the monoamine theory came. Just lacking one thing causes one disease. So could something like that cause depression? So since they knew of the properties of serotonin, how it could elevate mood and make people happy, the drug companies who are already working on the SSRIs, they're already good to go. They had no use for it though until this research started to come about. So once that research came about, pharmaceutical companies were all over it. They went to the medical community and said, we already have the research done. Our drug keeps serotonin high. Serotonin low, depression. Serotonin high, happiness. The drugs keep serotonin high. So they went from, does a serotonin deficiency, this is the biggest thing, does a serotonin deficiency cause depression, to do SSRIs keep serotonin levels high? They missed a step, didn't they? They completely missed it. They completely skipped the fact that they didn't even know if normal levels of serotonin had any effect on depression. So they knew that a serotonin deficiency might lead to depression, it can cause it, and they knew the drug increased serotonin. So, am I saying that no person with depression had low serotonin? Absolutely not. But they're using that monoamine theory that only serotonin deficiency causes depression, and the drug does increase the serotonin. Therefore, depression cured. And if you've taken an SSRI and you've been depressed, how many of you got worse? Can you possibly get worse if it's true that increasing serotonin makes you happier? Cannot. It's not the way it works. Okay? So in this article it says that although it is often stated with great confidence that depressed people have the serotonin deficiency, the evidence actually contradicts these claims. Indeed, no abnormality of serotonin in depression has ever been demonstrated. So like I said, am I saying that no depressed person ever had a serotonin deficiency? Absolutely not. Absolutely not. But these depression meds have literally saved people's lives. Literally saved people's lives. Many, many people's lives. By going on these medications, they've saved their lives. So I'm not bashing medicine at all. But what we need to be on it, right? You may need to be on it right now. You may need to be on this medication right now to save your life, right? Otherwise, life is miserable, massively depressed. You feel like the rain cloud is constantly following you. And without the medication, you just don't see any way out. But we have to find out why this is happening in the first place. Otherwise, you are now dependent on that medication for the rest of your life. If it works. Okay? Now, let's talk about some of these neurotransmitters, because we have a bunch of them and they're all made in different places. So this is not a comprehensive list. But think about adrenaline, think about fight or flight, right? So every single one of these can interfere with your brain and body communicating. So any imbalance here can cause depression. So where are they made? Well, adrenaline, noradrenaline, those are obviously made in the adrenals. It's right in the name. Dopamine is actually made by the kidneys and it's stored in the adrenals. Serotonin, like I said, 90% of that is made in the gut. So we're talking fight or flight, stress, we're talking ability to concentrate, dopamine, pleasure, right? Serotonin is a mood elevator. And then we have GABA. GABA is the most calming, right? So it's actually converted in the liver from glutamate and we store it in the pancreas. So acetylcholine is made locally in the muscles. Glutamate is made by the immune system. And then you have endorphins made from the pituitary gland. You have all these things, all these different systems working together to create balance in the body. So if they're made from the adrenals and you're constantly in fight or flight, you're going to necessarily create an imbalance. Body is made to stay in fight or flight for a very short period of time. For example, when there's a major stressor like you're being chased by a tiger. Once you get to safety or you beat the tiger up, you come out of fight or flight. And then we have no more stress in our lives. Or now, we don't have it on me. You pick up your phone and you constantly keep stress with you in your pocket 95% of the time except when you're sleeping. Right? It's always right in front of us. There's always something distracting us, causing stress. So we keep putting that demand on the adrenals, and when the adrenals produce and store a lot of these brain hormones, a lot of these neurotransmitters, and we're putting extra tax on those glands, or if we're eating a ton of sugar, we're putting extra tax on the pancreas, and the pancreas is supposed to store that GABA, which is very calming. It's hard to create balance with these things. So by putting these extra stressors on our body from different foods and from different external stressors, we're throwing these systems off. But these can all be figured out. And in the following weeks, what we'll discuss is different ways to test these things and find out how can we start to remove the stressors and to create balance in the body. But what if you're doomed? What if it's genetics? So let's look at genetics for a second. Because are you predestined to be depressed because your parents were, or anxious because your parents were? Not so fast. So, genetics, mental illness sometimes runs in families. That sentence has nothing to do with genetics. Running in families is familial. That is because so often we are raised in an environment where it's our normal and we expect it to be normal. So suggesting that people who have a family member with a mental illness may be somewhat more likely to develop one themselves. So then they switch back and they say susceptibility is passed on in families through genes. Those two sentences are basically contradictions. They're saying run in family and they pass them on in their genes. Not so fast. So experts believe many mental illnesses are linked to abnormalities in many genes rather than just one or a few, and that how these genes interact with the environment is unique for every person, even identical twins. How these genes interact with the environment is unique for every person. That is why a person inherits a susceptibility to a mental illness and doesn't necessarily develop the illness. Okay, all right. Mental illness itself occurs from the interaction of multiple genes and other factors, such as stress, abuse, traumatic event, which can influence or trigger an illness in a person who has an inherited susceptibility to it. Here's the problem. Look at the numbers. If we look at the numbers specifically, you have men and women. Men are blue, women are yellow. If it was genetic, these numbers would be a straight line across. They would not increase. They would stay. So the diagnosis rate, diagnosis by gender, 2016, it keeps increasing. If it was genetic, they would not increase. That's it. It'd be a straight line across. Right? So there's interference. There's interference throwing these bodies off from environmental stressors, environmental toxins, biochemicals, antibiotics. They're spraying in all the food and everything, destroying, creating damage and imbalances in the system. And now we want our body to be normal, not be affected by all these bad things out there. but you can't ignore the fact that every single person on this planet is affected by them. Okay? How we express that damage is different for everybody. So when we look at outside factors, well, how do they affect the brain? Well, let's take other medications. Let's take something that's very extremely common that most people think is just a normal fact of life as we age, and that is high cholesterol. Is cholesterol bad? First off, well, let's see. So the importance of cholesterol in brain function and memory. So a large amount of cholesterol is found in brain tissues where it is needed for normal brain function, where it is needed for normal brain function, where it is needed for normal brain function. Research has shown that cholesterol is vital to older people whose memory is declining. And the brain, this is from Washington University School of Medicine in St. Louis, the brain represents only 2% of your body weight, but actually has about 20% of your body's cholesterol. So what happens if we take a medication that is designed to lower our overall cholesterol? What does that do to the brain? Well, if the brain needs it, if you stop feeding the brain what it needs, it starves. Now, I remember when I was growing up, I remember hearing about Alzheimer's disease and dementia for the first time, like first grade, like somebody's grandma had it or something like that. And then it just became more and more and more and more common. As we increase the sugar, as we decrease the fat, the brain is made up about 4% sugar. It feeds on sugar, absolutely, readily, okay? But it's made up primarily 60% fat, and a quarter of that fat in the brain is cholesterol, okay? So statin meds, when you look at their side effects, depression is actually listed, and fatigue and memory loss. But your cardiovascular is safe because you're taking this. Well, cardiovascular disease still happens to be the #1 killer among men and women. So do you really think taking these things are actually helping or causing other problems? Well, like I said, what are the unintended effects of lowering circulating blood cholesterol? Now we have depression, we have memory loss, we have fatigue. We're starving the brain. Psychosis and even suicidal tendencies. When cholesterol levels, this is something I always talk about, is there's a red line in the sand. High, I don't care. Your body makes cholesterol. It's not going to make something that's bad for you, right? I worry about triglycerides, absolutely, for sure. But when cholesterol is increasing, the body's using it to help repair tissue. It needs it to heal and repair. When it starts to go low, and there's a line, studies show, below 150, increased risk of anxiety, depression, suicidal thoughts, they skyrocket. So be careful. Make sure your body is doing what it's supposed to be doing and you're not putting in interferences because some faulty study back in the late 70s, early 60s and 70s said so. Okay, it's bad science. All right, enough about that. So, Journal of Neurology actually posted this, that high total cholesterol levels in late life associated with a reduced risk of dementia. Reduced risk. High cholesterol, lower rates of dementia. In this study, it said some people have developed memory loss or confusion while taking statins. These side effects reverse once you stop taking that medication. So once again, it's not a side effect, it is an effect. There's a limited evidence to prove a cause and effect relationship. So these are the effects. So in conclusion, in that world, cholesterol only related to heart disease, right? They don't relate it to brain function because they don't read their own research. This is their own research saying it directly affects the brain, not just the cardiovascular system. It's got to affect the other parts of the body. So what do we do that directly affects our cholesterol and sugar levels? We eat a bunch of junk, right? So processed grains, processed dairy, conventional industrialized dairy, I should say, soy, processed sugar, all these things have a direct effect on your body's health, your brain health, your gut health, how your body is able to produce these neurotransmitters, how it's able to correct and heal and repair. Because can your body heal and repair if you're eating all this junk? Yes. Will it heal and repair faster or slower? And if we keep eating it, if we keep stubbing our toe, what's going to happen to our toe? it's going to get damaged, it's going to get bone spurs, and eventually it might be damaged enough to where we can't even move it, and it's a constant source of pain. All that stuff in that picture can do the exact same thing, but when it's specifically in here and you're producing all those brain hormones in there, you're taxing out your blood sugar, you're taxing out your pancreas, so that the calming and the excitatory, all these different neurotransmitters get out of balance, and now we're looking at all these different mental health issues coming to the surface. So you can't eat junk and expect your brain to function normally. You can't eat junk and expect your body to function normally. Okay? We are what we eat. And if we eat junk, your body's a junkyard. Okay? So I just wanted to get you started with our perspective on mental health. It is a very, very serious and very real thing, and it's getting worse and worse and worse. How many more pages do we have to print out of these mass attacks, these massive suicides, murder-suicides, workplace violence, school shootings, attempted suicide, murder. It's just getting worse. So let's actually step back, take a check on our health, figure out what's stressing our body out from a traumas, toxins, thoughts perspective, remove the triggers, and give our body the nutrients it needs to heal and repair and create some balance. All right, so let's talk a little bit about Wellness Way product knowledge. Now, one of my favorite herbs for anybody with cognitive issues is going to be Ginkgo, right? From Ginkgo biloba. It is considered a cerebrovascular stimulant as far as helping blood flow to the brain, a circulatory stimulant, and a blood thinner. Studies have actually been done that it is actually amazing for helping with cerebral insufficiency. Well, how does it do that? Well, it's effective for increasing cognitive ability, helping with memory, increasing concentration capacity, reducing mental fog, helping depression, increasing energy and vitality, especially for when cerebral vascular insufficiency is present. Okay, so as one does get older, blood flow to the brain, peripheral tissues decreases, and with inflamed tissues, it decreases exponentially. So Ginkgo can actually help stimulate that system and actually increase the blood flow. It is famous for assisting memory, focus, cognition, and while it may help even kids with studying, right? So especially when they're stressed out, they're decreasing blood flow. It can actually help with memory, cognitive thinking, but always going to be best when there is a specific vascular problem. So anybody with a lot of sugar in their system, anybody with systemic inflammation, cardiovascular inflammation, Ginkgo is definitely going to be one of the greatest things to help those people. So what it can do is actually can cross the blood-brain barrier and actually help increase nutrition to the brain. Okay, and when you increase nutrition to the brain, you actually help the brain function better because there are very extremely tight junctions in the blood-brain barrier. So you cannot get things out of the bloodstream and into the brain very easily. It has to go through channels. So what happens when there is cardiovascular or neurovascular stress or inflammation, now you have circulating toxins and all these other things that can actually cross that blood-brain barrier if those tight junctions are compromised, right? So one, helping with increasing the blood flow to the brain is major. But you gotta remember, these things, just like everything else, doesn't work overnight. But after a couple weeks, you can actually see these things start to really rear great effect, right? So, especially with diabetics, also Ginkgo is major cold hands and feet, Raynaud's syndrome, can help with that vascularization, helping get these things into the brain, to the body, and helping the body just to support the overall nutrition. So when you're trying to get the body back on track, when you're trying to get back into a healing phase, getting these things back in is massively beneficial and necessary until the body can heal and repair, and then the need for these things becomes less and less and less. So the healthier person Healthy person doesn't need any medications. A healthy person doesn't need any supplements or anything like that, except to support where their diet nutrition is lacking. So nutrition supplements, well, I shouldn't say nutrition supplements, but supplements are designed to bridge the gap to where you don't need them anymore. They're designed to buy time for the body to heal after we identify the stressors so that we can do just that. If you never identify the stressors and you keep doing the same things over and over and over again, whether it's bad food, whether it's mental stress, worrying about everything, or sitting, staring at cell phones and having bad posture and slumping and crossing your legs and having that neurological stress. If you keep doing the bad things, don't expect your body to have this miraculous change. But if you identify those things, you make the changes, we can help guide the ship and help your body get into a state where it can heal. And then as long as you keep doing the right things, feeding your body what it needs, it can continue to heal, 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 and repair to where you get out of it what you want. Okay? So, thank you guys. I just want to jump in, give a quick snippet on my final thoughts. Okay, folks, really what I want to get across is there is a lot of mental health issues facing this country today, and I think we can all agree we're all much more aware of it based on social networking, based on the news, based on all the publicity all these things are getting, and it's not normal. It's not. It is way too common. But don't shrug these things off like these people who are massively depressed, people dealing with anxiety, people with obsessive issues. Don't think that they're faking. It's real, right? It is real. It's 100% real. Respect that, please. Always respect that. These people are going through things that we can't possibly imagine. We don't know what it's like to be in their skin. So if you know somebody who's struggling, listen, help, do anything you can. Speak to them, speak into them, let them just talk, listen. Do something. So if you know someone, if you think we can help, let them know we're here, point them in our direction, even if it's just listening to us talk via computer, via one of these talks, different perspective. We have mental health talks out there. We talk about lots of different things, point them in our direction, let them learn, and we're here to help. We're a place of hope. Have a great Saturday.
Hey, thank you for watching. Make sure to subscribe to this channel so you don't miss a single video or live stream. Also, share this video with a friend. Once again, thank you for watching.